Oh, man. I'm feeling really bad, Nick.
What's going on?
I don't know. I feel like I have like the aura of like a seizure or something, you know, because I felt like this, you know, like the last time I had one. So, what should I do, Nick? I think I'm gonna lay down. You should call EMS or something.
All right, I'll call EMS. Hey, EMS, my friend's having a seizure. I don't know what to do. Can you guys send somebody?
Pulling up to the scene. We got our PPE on. All right, we're doing our doorway assessment. We see one man on the ground, another man flagging us down, and no other visible threats, but we'll remain vigilant this entire time. Let's go, brother. Okay, nature of illness. The call was about a seizure. Patient seems to be confused and lethargic. Number of patients is 1. No current additional resources, and C-spine is not needed right now. So we are going to make patient contact.
That was a solid death. All right. General impression seems to be working age male. Supine on the ground. Seems to be postictal, or well, in the postictal state. Level of consciousness using the AVPU scale would be alert but disoriented. All right. No major bleeding seems to be present on the patient. His airway seems to be patent. A little bit labored though. His breathing, he seems to be hyperventilating. And then Jeff, if you don't mind palpating his pulses and checking his regals.
I'm checking his bilateral pulses, and he seems to be tachycardic. We assessed his vitals. His blood pressure is 138/88. His pulse is 110. His respiratory rate is 22 breaths per minute, and his skin is pink, warm, and dry.
All right, Jeff. Would you mind performing a BRAP exam on the patient for me?
All right, I'm gonna palpate his body and feel for crepitus and any other types of pain or anything out of the ordinary.
All right. Shaking down.
All right, didn't feel any crepitus or anything out of the ordinary. Everything seems to be good besides it being like this.
Okay. Then priority is going to be it's going to be priority 2, but it can change in the future. Yeah, we'll just prep for transport. Okay. So right now we are going to administer some oxygen through a nasal cannula at 6 liters a minute. The reason why we're not using a NRB is because an NRB, if they start seizing up while they have the mask on their face, it could slip and move. So what we're going to do is just give them the nasal cannula and then apply some tape to the sides of the nose so it doesn't move in case they do have another seizure. Then we're also going to administer LSD.
LSD?
Which would be light sirens diesel.
All right, man, since you were the only other guy there, what can you tell me about the signs and symptoms of this?
He has regular seizures, but he didn't come back normal this time.
Okay.
Patient seems to be coming out of the postictal state too.
All right, well, since he's coming out of the postictal state, we're going to ask him the rest of the medical history questions. Thank you. All right, man, do you have any allergies, bro?
No, I don't really have any, I think.
All right, no allergies. What about any medications? You take any meds?
I'm currently taking phenobarbital.
Okay, he's taking phenobarbital. What about your past medical history?
I have regular seizures that happen from time to time.
All right, regular seizures from time to time. When was your last oral intake?
My last oral intake was probably dinner this evening.
Dinner this evening? Okay, well, what about the events leading up to the seizure?
I was just studying with my friend, and then I felt this like weird aura come along, and it felt like the last time I had a seizure, so I had to really lay down for this one.
All right. Man, we're gonna do the secondary exam. I'm gonna palpate his body and see if he's feeling any pain and ask him if he fell. Hey man, I'm just gonna touch your body a little bit. Tell me if you feel any pain. Did you fall or anything?
Oh no, man, I didn't fall or anything. I don't really feel any pain anywhere.
Okay, didn't fall, no pain. Nice. All right, for neuro, I'm gonna do Pearl and check his pupils for their reaction. they're reacting normal. And then I'm gonna do the fast stroke scale. So I'm gonna check his face, his arm drift, his speech, and time to go. So, all right, so his face, can you smile for me? You open your eyes, close your eyes. Let me see your arms. All right, keep them up. Dope. Do you know where you are?
Yeah, I'm here over medical.
All right, speech seems fine, and time to go. We're already rolling.
Alrighty. So right now I'm going to go over the musculoskeletal check. We already asked about pain and everything, so kind of clears that out. And then we also checked earlier for crepitus and everything as well, so he's good on the musculoskeletal signs as well.
So for the psych portion, we're gonna run through the AVPU scale, and then we're gonna also ask him about any stress and anxiety that he may have been experiencing. So, sir, do you know where you are right now?
Yeah, I'm at alert medical.
Okay, do you know what year it is?
It is 2026.
Okay, do you know who the President of the United States is?
That'd be Donald J. Trump.
All right, have you been experiencing any stress or anxiety recently?
I've been pretty stressed out recently.
Pretty stressed out.
Yeah.
Okay, thank you. All right, for reassessment, we're gonna reassess this patient every 15 minutes since he's alert and oriented and out of the postictal state.
All right, for the diagnosis, this patient suffered from a tonic-clonic seizure.
So for the pathophysiology, it results from abnormal electrical discharges from large areas of the brain, sudden LOC followed by chaotic movement and tone, plus apnea. Tachycardia, hyperventilation, sweating, and intense salivation. It lasts about 3 to 5 minutes.
He seems to be tachycardic.
Awesome.